What was the last class topic? Laboratory hazards and safety. So what were the 4 types of hazards that we can come across? Clinical, chemical, biological, yes, and electrical and fire hazards. Yeah. So, and also we studied the biomedical waste management. Okay. So you tell me, yes, stand up. Tell me what kind of waste we discard in the yellow container? Biological, are you sure? Or anatomical? Anatomical waste. Yes. What could be some anatomical waste? Placenta. Okay, sit down. So you tell me what kind of, where will we discard a syringe? What color? Blue one. Why? What happens to the syringe when it goes to the blue one? Blue. Are you sure blue is? Red can be recycled. So where will you discard the syringe? In the red. Yes, exactly. Okay, so please go and read little bit, okay? Read your textbooks. What? Transparent. The syringe. Did I say syringe or needle? Syringe. So in transparent you will discard the syringe or the needle? Needle. So properties and normal constituents of urine. I am not waiting for anyone if somebody is lacking, okay? We are already late. So before you know the abnormal properties of urine, you have to know what is there. The normal constituents of urine, you have to know that first, and then we will go to the abnormal constituents. See, this is the rough idea of the anatomy of our renal system. So this is the basic idea of the anatomy of our renal systems: the kidney, the ureter, bladder, urethra. Okay. Now, introduction. Urine is one of the most easily obtained specimen examined in the laboratory. Urine analysis not only provides information about the functioning of the kidneys and possible abnormality of the urinary tract, but may also provide important leads in diagnosis of various systemic diseases. Now, when we go to a doctor, the advice for urine test, right? Now, it helps us in the diagnosis of the disease. It gives us an idea, like it could lead to that particular disease. Now, suppose during dehydration, when somebody is suffering from dehydration, what happens is the specific gravity, you know what is the specific gravity of urine? That increases, okay, because the water concentration, it decreases. That's why the constituents, the components of the urine, that increases the specific gravity of the urine. So urine is formed, so this is the basic physiology of that, the urine system, the physiology of that you will be taught in your physiology class. So this is just a basic. Urine is formed by, don't talk. हाँ वो मैं समझा दूंगी, वो है मैं समझाऊंगी. Urine is formed by ultrafiltration of plasma by the renal glomeruli of the kidneys. The tubules reabsorb most of the water and some solutes and secrete substances into the tubular lumen. The urine is passed from the kidneys through the ureters for the temporary storage in the urinary bladder, and we finally excrete it out. So basically the thing is, the blood, it goes to the renal glomeruli, okay. From there the kidney absorbs some constituents, and the constituents that are excreted out, that come out as the form of urine. Some are excreted and some are excreted out. So the excreted out part is the urine that we call, which has the components that we will talk about here. It removes many waste products of body's metabolism, and at the same time regulates water and electrolyte balance as well as the acid-base balance of the body. So what happens if we are excreting more amount of acid? What will happen? It will cause alkalosis to our body. The alkaline level will rise in our body, so that will form alkalosis. So in the same case, if more amount of base is excreted, then it will form acidosis. Those are some medical conditions that we will get. Okay. Now, metabolic imbalances are often reflected as a change in the composition of urine. Urine analysis therefore is of great help to physician in formulating a disease. So by analyzing urine, okay, like the volume, okay, the pH, we can find out the medical condition of the patient. For in diabetes insipidus, do you know what is diabetes insipidus? Diabetes mellitus. So in diabetes insipidus, what happens is the patient will complain of I am micturating more and more amount. So what happens, the concentration of urine there, the water is more. Okay, during diabetes insipidus, the concentration of water is more in the urine. Okay, in that case, the analysis of urine, we can get an idea that it could be diabetes insipidus. So in physical examination, we check for the volume, color, odor, transparency, specific gravity, pH and deposits. In chemical examination, the one that you did, the Benedict test, so that is the chemical examination of urine. In that we check for the normal constituents as well as the abnormal constituents of urine. Now normal constituents, you guys have seen the urea in a lab report, you have seen the urea, creatinine or uric acid in the lab reports, have you seen? So those are the normal, okay, normal constituents we check for. So in microscopic examination for various cellular components, example RBC, pus cells, epithelial cells, etc., and all different types of non-cellular components such as crystals. Now what is pus cell? Do you have any idea? Pus cells. Do you know white blood cells? Suppose somebody got a cut. Do you see some thick white material? Sometimes it comes. What is that? That are the dead white blood cells. When we get any cut or any infection, what our body does? It fights against the bacteria or the germs to protect us. Our immunity does that. So in that process, the bacteria also get killed as well as the WBCs also get killed. So those dead WBCs causes the pus. So that is the pus cells. So some history of urine examination. Ancient Egyptian physicians used to taste the urine to find the disease. Indian physicians started to use urine for diagnosis of diseases in almost 2000 BC. Now Greek physician Hippocrates also recognized the value of urine examination, and he noted that the color, odor and even the taste of the urine helped in the diagnosis. Okay, so you tell me, have you tasted your urine? What about you? The guys will have some curiosity, I think. Have you? Anyone tasted the urine? I would say you all have tasted. Really? He did. You tasted? No? No one? I have also tasted my urine. So this is just for fun fact. When we are inside our mother's womb, okay, when we are inside our mother's womb, we swallow, we breathe the urine. Okay, the amniotic fluid, you know, majority of the composition after 5 months of the pregnancy, development of the fetus, a majority of the composition is the urine of the fetus itself. Okay, so this urine helps in the development of the lung of the fetus. Okay, so like that, yes, we have tasted our urine. So from next, if somebody asks, you can say, yes, I have tasted my urine, but I was not in my senses that time. So in the Middle Ages, urine examination also got important, and they started measuring the specific gravity with a urinometer. In the 17th century, with the invention of the microscope, so in the 17th century, with the invention of the microscope, urine examination started helping in the diagnosis of various diseases like hematuria and bacterial infection. Now any idea what is hematuria? Huh? Yes, blood in urine, yes, basically blood in urine. So that helped us. Under the microscope we could see that the presence of blood in urine. Yeah. So in modern era, urine examination diagnosed diabetes mellitus, proteinuria and ketone bodies. Now the analysis of urine is actually the beginning of laboratory medicines. At that time the physician checked the urine gross appearance like the color, turbidity, odor, volume and the urinary infections. Chemical testing progressed after the ant gathered around the diabetic urine. So you can see here a urine sample spilled and there are some ants gathered. Okay, so like that they understood maybe the patient could be diabetic. So suppose you went into the washroom and you urinated, and again when you went after 1 or 2 hours, you saw that few ants are there. So do you think you are diabetic? Yes? So you'll go to a physician saying that I am diabetic because there were ants in my urine. Do you think so? No, that's not how it is, because just see, a little portion of glucose can be excreted through urine. When it is more, then it could be diabetes. Otherwise, due to physiological things also it can be excreted. That is normal. Okay. So how can we say? There could be other associated things as well. The clinical presentation, the complaints of the patient, you have to note that. Okay. Now what could be the complaints? What could be the complaints? That the patient can come, that there is some ants on my urine sample, but I am also very hungry. I am very hungry. The frequency of the micturition has increased. I am having tingling sensation in my feet. These are some of the complaints of a diabetic patients when they are newly diagnosed. This could be some complaints that we can come across. So just seeing some ants in your urine, you cannot say you are diabetic, okay? So chemical testing, so the advent of the microscope in the 17th century led to the examination of urine sediments. Now you can see the odor, the volume, color. This is just for your understanding, this picture, okay? Now, modern urine examination. Now, why is the modern urine examination so popular? The modern urine examination is popular due to easily available sample. Urine gives much of the metabolism information, and this information from the urine is cheap. The National Committee for Clinical Laboratory Standards, NCCLS, defines the urine analysis procedure as reliable, accurate, safe and cost efficient. Now, in a normal healthy person, the urine is sterile, clear, amber color, it is slightly acidic, pH is 5 to 6, this is just average value 5 to 6, and specific gravity is 1. Should I off the fans? Off the. Some of you are coughing. That's why. Okay, so the specific gravity is 1.024 and it has a characteristic odor. Daily output should be 800 ml to 2500 ml. That's the daily output, that much it should be. Okay. Now, the urine composition. The kidney continuously form the urine as an ultrafiltrate of the plasma. Reabsorption of the water and filtered substances are essential to the body's function, converting roughly 1,70,000 ml of filtered plasma to the average daily urine output of 1200 ml. So basically your kidneys are always functioning, and on an average per day they filter 1,70,000 ml of plasma, out of which 1200 will be excreted out and the rest is absorbed back into your body for the proper functioning. Now some inorganic substances like urea is a product which is a product of the liver by the breakdown of proteins and amino acids. This is the 50% of the dissolved solid substances in the urine, and other organic substances like creatinine and uric acid are also present in our urine. As well as some inorganic substances, like the major substance will be chloride followed by sodium and potassium. Have you seen in lab reports sodium, potassium? Yes. So other examples are, which are in inorganic, are sulfates, phosphates, calcium, ammonia. The dietary intake makes it difficult to decide the normal level. Now what does this mean? How is the dietary intake affecting in the result? Why do we advise for a early morning sample, early morning blood sample, or early morning urine sample? Yeah, so that the dietary intake does not, mix match the accurate levels. Now how it can? Suppose salt, okay, salt, sodium. If somebody has a habit of intaking a lot of intake too much big amount of salt, right? So when you take that and you go for giving the sample, it will give you a wrong sodium result, right? So that's why your dietary intake can, give you a wrong result. And in another composition of urine, there is water, and other substances found are hormones, drugs, vitamins, cells, cast, crystals, bacteria. Now what kind of hormones we can find in urine? Any idea? HCG. Yes, beta HCG, very true. What does it help us to detect? Pregnancy, yes, that is also true. And anything else? Anything else? Yes, you are going in right direction. Cancer. It also helps us in detecting cancer. Beta HCG is one of the gold standard of confirming pregnancy. Okay, the levels will be higher during pregnancy or cancer. Now some drugs, vitamins, cells, cast, crystals, bacteria, those can also be found in our urine. So this is the composition of normal urine, and these are the pictures of the crystals and the cast. So in the composition we have 96% water and 2% urea, and 2% could be uric acid, creatinine, ammonia, sodium, potassium, chloride, phosphate, sulfate or oxidate, little or more, but it will be present in our urine samples. Now that these are normal cast and abnormal cast, this is just for your picture thing, okay? No need to buy hard or anything, just so that you understand. Now this, you see that calcium oxalate or this calcium phosphate or cysteine, leucine, what happens is when the amount increases, this can form the, have you heard of the kidney stones? This is what forms the kidney stones, okay? When the amount increases in the body, when the kidney is not functioning properly, it cannot excrete it out, so this is what it forms. Now uric acid, the more amount of, they say, right, if you are having high levels of uric acid, don't take proteinaceous meals, avoid red meat, okay. What happens is, if the kidney is not functioning properly and not excreting out the uric acid, it gets stored, and from there it can go to your, where? What? Joints, yes, exactly. Gout, yes. So yeah, so the hyaline and this waxy, this cast, you can see the hyaline is one of the most common casts. So casts are basically the cells, the clumped up cells. So the hyaline are one of the most common casts that you can see, and this waxy cast, and this will be seen in chronic kidney patients. This waxy cast, these are very common in chronic kidney patients. Then the granular cast, okay. What is this? For people to focus, don't lose your focus, just a little fun, not to make the class boring. Now the physical properties. Now in physical properties we have volume. A normal healthy adult excretes about 800 to 2005 ml of urine daily. That is the normal range. Several factors like water intake, excess water loss by recurrent vomiting, diarrhea, burn, heat stroke, climatic conditions, fever or drugs may affect the urinary output. So water intake, like if somebody is micturating, frequently going, so does that mean that he is diabetic or what, diabetic insipidus? No, maybe he is having more amount of water, that's why he is going again and again. Now during vomiting, what happens? We lose some electrolytes from our body, we lose water, that can also affect. And in case of diarrhea as well, the same. Now burns, in burns what happens, burn patients need fluid therapy, because what happens, the microcapillaries of the body, from there the fluid oozes out due to burn. So that can cause severe dehydration in the patient. That's why burn patients always need fluid therapy. Heat stroke, climatic conditions in some tropical regions, that can affect the volume of the urine, the output. Now fever or drugs may affect the urine output as well. Fever as well, what happens, the body temperature increases. Now during fever we fall sick, we don't feel like eating, we don't take proper nutrition, proper fluid, that can also affect. A single sample of urine voided at any time does not give any significant idea about the state of the kidney function. Yes, you cannot say a patient is having some kidney disease just seeing one single finding, just with one single test, you cannot. And most importantly, you have to know EGFR. Do you know what is it? Glomerular filtration rate, excreted glomerular filtration rate. That is very important to say a patient is having any kidney condition, that the kidneys are not functioning properly. So polyuria, oliguria, anuria. What is it? What is polyuria? And the next one, oliguria? Huh? Yes. And what is anuria? What is dysuria? Huh? No. Dysuria, painful micturition. Okay. And what is dysphagia? Hunger. In diabetic patients, they'll complain, I'm very hungry, I'm frequently feeling hungry, I want to eat more. Okay. So polyuria, excess volume of urine output with the increased frequency more than 2005 ml per day. The patient will have more than 2005 ml per day. It may be physiological or may be due to metabolic or systemic disease in diabetes mellitus, DM, or may be drug induced. Any diuretic, if the patient is getting any form of diuretic, they'll have this. Oliguria, decreased volume of urine output less than 500 ml per day, maybe to less intake of water or due to dehydration, or maybe early symptoms of renal dysfunction or renal failure. If you are taking less water, you will excrete less water only, less urine only you will excrete. So physiological importance is there. Anuria, that is the complete cessation of urine output less than 100 ml per day. It is very alarming state and is not treated properly, and if not treated properly may lead to complete renal failure or may be fatal as well. Anuria means there is complete cessation or less than 100 ml. Now in case of a acute kidney disease patient, what will you do? There is chronic kidney disease, CKD we say in common terms, and there is acute also. So maybe sometimes we see that after some major OT, okay, suppose after a cardiac OT, the patient is not urinating, the output is not there. So that time what we do, we give 1 or 2 set of dialysis. Okay, so after that the patient gets, it resumes back the proper functioning, the functioning of its own, it can resume back. So that is normal in case of acute kidney disease, yes. And in case of chronic, obviously they need dialysis. Now the color, normal urine is straw yellow color due to the presence of urochrome, which is a byproduct. Slight variation in color may be because of fever, dehydration when it will be darker, and tinged due to drug, vitamin B complex. Have you seen when you take vitamin, multivitamin, you see your urine color changes, right? And it also gives some sort of smell. Sometimes when we take some sort of antibiotics also, it gives some sort of smell. So these all affects. In case of anti-tubercular therapy, ATT, when the patient is taking ATT, the urine color will change. It will be orange, red in color. Or due to certain dyes used in investigation like methyl red or methyl blue. So these dyes are used in cancer patients to check the spread of the cancer in the lymph nodes. Suppose if patient is suffering from breast cancer, they give it to check how much the cancer has spreaded in the lymph nodes. That time they use this. So that can affect in the color of the urine. Dark yellow to orange in cases of jaundice, red or smoky in cases of hematuria. Yes. Why? Why is it red or smoky in case of hematuria? Presence of RBCs, red blood cells. That's why. Milky white in case of chyluria. Yes. What is chyluria? What is chyle? Yes. What happens when we take food? What happens to the food? It gets digested. How does it get digested? Who digests it? Yes. Yes. So the enzymes, okay, the bile, they get secreted and then they form chyle. Okay. So what happens? The chyle get absorbed in the intestine. Now, yes. So that is chyluria. When it is in the urine, when it comes in the urine, that is chyluria. So it is milky white in the case of chyluria or nearly colorless in case of diabetes insipidus. Why is it colorless in diabetes insipidus? What is diabetes insipidus? Huh? What I just told right now. More and more amount of urine, the feeling, the sensation of, so what, the water is more. So in the urine sample, the water concentration will be more. So what will it do? It will dilute it. So that's why it will be more clear. Simple thing. Now odor. Normally the odor of urine is faintly aromatic due to certain volatile organic acids. On decomposition, a very unpleasant ammoniacal odor evolves. Food, beverages and drugs may impact a specific odor to urine. Sweet fragrance is due to presence of acetone in urine and is of diagnostic importance in ketonuriae. DKA, diabetic ketoacidosis. Okay, the smell will be sweet. The smell of the urine will be sweet. Also the food habits, it does affect. That is why we say always give good things to your body. Now a pungent smell will be seen in when there is ammonia in the urine. There will be some pungent smell. Okay, M-soot. Have you heard of M-soot? In M-soot, the smell will be burnt sugary smell will be there. Okay, and sweet smelling in case of when there is ketone bodies in urine. So transparency. Normally freshly voided urine is transparent. After prolonged exposure, it may turn turbid because of growth of bacteria colonies. Phosphates may also make it turbid. Turbid means it's not clear. Okay. Now specific gravity, this is very important. Somebody asked about specific gravity, I think. Yes, this is very important. Normally specific gravity of the urine ranges between 1.012 to 1.025 depending on various factors like diet, fluid intake, drugs, etc. Why fluid intake? Because the specific gravity will be more during dehydration because the water is less, so the specific gravity will be more. Variation is common, but a fixed low or high specific gravity is pathologically significant. It is high in diabetes mellitus, acute nephritis, and low in case of diabetes insipidus and chronic nephritis. Specific gravity of urine is measured using urinometer. Okay, this is urinometer. Now the urinometer is calibrated against distilled water at 20 degrees, that is the fixed degree, 20 degrees. For every 3 degree that the urine temperature is above, the calibration temperature add 0.001 to the measured specific gravity. Did you understand what it meant? Anyone? Nothing. So look here, can you see this? I am giving you an example. There is also example here. Suppose you took a urine sample in 35 degrees Celsius of the room. Okay, you cannot change it to 20, so you took it in 35. Now let's say that at 35 35 degrees Celsius, the measured specific gravity is 1.015. That means the measured specific gravity in the urinometer came 1.015. Just like in 32 degrees Celsius, the calibration, the specific gravity of the urine came 1.011. Okay. So the ideal calibration temperature should be 20. It should be 20. So what we do, for each 3 degree temperature change, we will add 0.001. Okay, for each 3 degree temperature we'll add 0.001 with the measured value, that is with the measured value that we got in here. Okay, so the corrected specific gravity that will come will be, this is maths, you have to know maths little bit, that is the 35 degree, that is the room temperature where you took it. Okay, in 35 degree what we got, 1.015. So 35 degree minus 20, that is the calibration temperature. What will it give? 15 degree. So 15 divided by 3, that is the 3 degree temperature change. Okay, are you understanding or any problem? So that will divide by 3 and we will multiply with 0.001. See, the specific gravity of urine should be measured at 1.001. Did you understand? Then what it comes, 5 into 0.001 plus 1.015, that was the gravity we got in the urinometer. Now it gives you 1.020. This is math, this is the formula. You have to understand this basic formula. Okay, the calibration temperature should be 20, and when you are checking the temperature, maybe 32 or 35, whatsoever the temperature is. This little bit of maths. Did you understand or should I repeat again? Yes. That is the fixed temperature, you can say, that we say some normal fixed value is there, and then we say that, let's say, so the ideal temperature should be 20 degree, okay, but let's say that we cannot always make that, we have to change the temperature to 20 degree. So we will, whatever temperature is there, maybe 32, 35, whatsoever the temperature is there, that will be there. So to find out the actual thing, we have to do this maths. So for every 3 degree rise, what will we do? 35 minus 20 divided by 3. Okay, then we will get the temperature, and then with that we'll multiply the 0.001. Okay. I don't know, you all are giving me blank faces. Understanding? Yes. हाँ हाँ क्या? हाँ हाँ, थोड़ा जोर से बोलो।
स्पेसिफिक ग्रेविटी जो टर्म है,
हाँ,
ये समझ में आ गया जो आपने पढ़ा है,
हाँ,
टर्म यहाँ पे क्यों है?
क्यों है? बिकॉज यू हैव टू नो द कॉन्सेंट्रेशन. क्योंकि मैंने जो बोला, देखो, सी, ड्यूरिंग डिहाइड्रेशन द कॉम्पोनेंट्स आर मोर. व्हाई? बिकॉज द वाटर इज लेस. Okay, since the water is less, the composition is, so you have to know. देखो, suppose, see, girls, look here. See, he asked that why the specific gravity. He understood, but why? Why is it important? See, suppose you take 2 glasses of water. In one glass you have added 2 spoons of salt. In another one you have added 3 spoons of salt. Which one will have more specific gravity? Obviously the one with the 3 spoon. That's why it's important. The constituent कितने में है वो, कितना water है उसमें, और the other particles are more. That's why it's important to know the specific gravity. Now the pH. Normally, you have done pH in your class 12? Check the pH of the urine. Yes. Normally, freshly voided urine is slightly acidic and turns alkaline after meal. It may vary due to diet, drugs, or in certain pathological condition. Normal range is 4.6 to 8, which is an average value of 6. So why does our urine turn alkali after food intake? What happens after food intake? What happens normally? What happens? We all know, when we take food, what secretes inside the stomach to digest it? HCl. What is HCl? Acid. So to balance that, alkali will also come, right? So some amount will get absorbed into the kidney as well. So it can give a result of, so that's why it becomes alkali after food intake. It's basic thing. Now deposits. On prolonged standing, sediments may settle at the bottom of the urine jar due to presence of mucus cells like red blood cells and pus cells or crystals. On prolonged keeping, there all these things can come. The mucus cells like RBCs, if the patient is having some kidney injuries, then all these things can show up in the sample. Now these are some chemical examination. I will not go into the detail, but you will do it in your lab, so you just know the names for now. Okay, for testing of inorganic constituents, detection of chloride by silver nitrate test, detection of inorganic sulfates by barium chloride test, detection of phosphates by molybdic acid test, detection of calcium by precipitation as calcium oxalate, detection of ammonia by Nessler test, Nessler reaction. This is important, this Nessler's reaction. Test for nitrogenous organic constituents, detection of urea by hypobromide test and specific urease test, detection of uric acid by Follin's test and chlororimide test, detection of creatinine by Hafez pictic acid reaction and Ligel's sodium nitroprusside test. These are the names for now, but whatever is required you will do in your labs. This comes in the chemical examination. Now in microscopic examination means what we see under the microscope. Some samples when we will check under the microscope, these are the things that we can see. Some red blood cells or the white blood cells, some cast, crystals, epithelial cells. What is epithelial cell? Yes, we can see suppose the urine is traveling, what happens? From the kidney through the ureter, it's coming to the bladder. Right, so if there is any acute kidney injury, during any injury or suppose any disease, any acute disease of the kidney, what will happen? There will be some epithelial cells can come off with the urine, so that you can see in the microscopic examination. Now any sort of bacteria and other microorganisms. Have you ever heard of urine culture? Urine culture test, some doctor has advised for urine culture. If somebody is having burning sensation of micturition, urinary tract infection, these are very common things. Okay, in that case they go for bacteria and other microorganisms. You tell me what organism causes urinary tract infection? Give it a try. What organism causes urinary tract infection? Have you heard E. coli? Yeah, that causes it. Now to summarize the physiological, take a snap of this. What, you don't have phone? Now in physical characteristics, we have the volume that should be 800 ml to 2500 ml. What is the condition we'll call? I taught less than 100 ml. Yes. So a color should be straw color. What is anuria? Asking me what is anuria? You forgot. I'll come. Odor should be aromatic, transparency clear. Transparency should be clear. Specific gravity should be between 1.012 to 1.025 and pH should be in between 4.6 to 8. This is the average value. What will we call if it is less than 8? Less than 8. Less than 8? Yes, you stand up. Yes. हाँ? What? याद नहीं. अभी तो पढ़ाया है, भूल कैसे जाओगे? क्लास तो खत्म भी नहीं हुआ. रूम तक का वेट कर लो भूलने के लिए. Did you understand the question? Are you present in the class physically? Yes. Mentally? No. He is in his own world. What will we see? The average value is 4.6 to 8. Okay, understand the question. pH you have read in your class 12, so I expect you all to already know it. It's a basic thing. Understand the question. If the pH is ranging between 4.6 to 8 and if it is less than 8, okay, what will be the condition? Huh? Acidic. And more than that will be what? Base. Yes, simple thing. Now there will be no deposits. Okay, if the patient is healthy, then his sample will not have any deposits. A little bit can be there, but that is negligible. As I said, because of physiological, that can be there. Some protein or some glucose can come out, but that is normal. But when the amount is more, then that is alarming. Now sit down. Now in chemical constituents, in inorganic will have chloride, that is 10 to 15 gram per day. Matlab that much rain or that much excrete we do, our kidney does that much excretion, 10 to 15 gram per day. Sulfate between 1 to 1.2 gram per day. Phosphate is between 0.8 to 1.3 gram per day. Calcium 0.1 to 3.0 gram per day. Know the values because you will be asked. And ammonia 0.7 to 0.8 gram per day. Sodium 3.0 to 3.5 gram per day. Potassium 2.0 to 2.5 gram per day. In organic that we come across mostly, that is that urea, uric acid, creatinine, the values are 25 to 30 gram per day. Uric acid is 0.5 to 0.8 gram per day. Creatinine is 1.0 to 1.5 gram per day. Now do you have any questions seeing this slide? The range, the values, any question that arises in your mind? Any curiosity coming knowing the values? Nothing? Now you can ask me that, ma'am, what if the creatinine is not 1 to 1.5? What if it is 2? Huh? You speak up, I can't hear. Be confident. See, when you are talking, be confident. We are all known here, so it's rather be fool for 5 seconds, okay? You'll be fool for 5 seconds even if you are asking a wrong question. But it's better than being a fool for a lifetime. So speak up, be smart. Yes. Yeah, creatinine more than 1.5, it could be 2, it could be 10 also. In case of kidney patients where the creatinine is more, they require dialysis. But what if the creatinine is not 1.5, it came 2, what will you do? No question arising, but I am asking you what in that case? What will you do in that case? You know angiogram, coronary angiogram, CAG. Has anybody's relative undergone CAG? Yes. Was he advised for this kidney function test? Yes. You know why? No, see, slight variation is acceptable. A slight variation that can be there, that is acceptable. Okay. So if it is 2, for an example I am giving, in case of coronary angiogram that we do to check the blockage in the heart, okay, the arteries in the heart. If suppose the range is 2, the value is 2, that doesn't mean that the patient cannot go through coronary angiogram. The patient can go, but a dye is don't sleep. If you want drink water, don't sleep. Yes, don't sleep. I'm seeing you dozing off. So it doesn't mean that he is having any kidney disease. Slight variation can be there. Obviously we should consult a nephrologist, a kidney doctor, but slight variation is acceptable. But in case of coronary angiogram, what happens? We accept till 2, but more than 2 we don't do, because why we check for the kidney function test is angiogram is done with a dye. Okay, a dye is injected in the body which goes into the arteries of the heart. Okay, and when the test is done, the patient voids immediately. on its own, the dye comes out. So if there is any problem in the kidney, will the patient void means with the patient urine? No. So that's why checking of the KFT, kidney function test, is important in case of angiogram, CAG. Now you understood how you can tell your father, right? Okay. 0.1, which one? That will be fine, that's okay, that's not any issue. Creatinine, if it is 0, the excess in if it is a problem. And also not like if excess, if it is 6 or 7, then we don't directly go for dialysis. Dialysis is the last option for kidney patients. And I tell you, a kidney patient, you know how they feel all the time. Do you have any relative who is suffering from CKD? You know what happens, how they feel, kidney patients? This is the worst disease that you can pray for somebody to suffer. It is that bad. It's like living under the water 24/7. What are the physical characteristics of a kidney patient? They'll have puffy face. We have early morning puffy face when we wake up, but then it resolves. But kidney patients will have puffy face. They'll have edema. Do you know what is edema? Water in any part of your body, in the feet, in the hands, in the face, because the kidneys are not functioning properly. That is why they have more amount of water. Okay, the things that should be excreted out, the kidney is not functioning, so they go through dialysis to excrete out those unrequired particles from the body. That's why the kidney patients always will complain of SOB. You'll get patients who came in the emergency, okay, and they know, kidney patients, they know they need dialysis. They'll develop SOB, shortness of breath, and they'll come in the hospital and they themselves will go and search for the oxygen mask and they'll put themselves. They'll not wait for you. This is like that. They know that, and they'll tell you, sir, please do my dialysis. So kidney patient lives, their life is miserable. So always be very patient to them, and they are always irritated. They are always irritated. Even if you talk to them nicely, their behavior will be very irritated, because just imagine if you put your face in a ball of water for 1 second, how will you feel? You'll feel like, no, not liking it, can't breathe, hesitant, but they are living that way. And there is no treatment. Obviously you can say, ma'am, transplant, but getting a suitable kidney and having a transplant, that is a big thing. Transplant is like, it's good to hear and it's satisfactory, but doesn't mean that once. And also if the patient had a transplant, doesn't mean that he is 100% cured. Anytime your body can reject, anytime it can reject, and you are more prone to getting infection. Once your body is going through any transplant, kidney transplant or any sort of organ transplant, liver transplant, doesn't mean that you can get to your normal function. No day to day. Many restrictions are there. You have to avoid certain diet. You have to be very cautious. You cannot get infected. You cannot go certain places. Always use sanitizer, mask, because your immunity, basically your body immunity reduces. So it's nice to hear that we have transplant, but that's not the whole solution. I know a patient who had kidney transplant, but again went for the second kidney transplant, and also getting a suitable matching kidney, that is also quite a procedure. It's a task. So always be patient to kidney patients. Okay. So peace out.